A very good morning, respected jury members, professors, and my dear friends. Today, I would like to present to you on the topic Knowledge and Attitude on Mouth-Nose Covering for COVID-19 Protection amongst dental students. Mouth-nose covering is an essential tool of self-protection against any airborne infection, especially in the case of severe acute respiratory syndrome coronavirus 2, also known as SARS-CoV-2. The main route of transmission is the inhalation of the virus either by virus-loaded respiratory droplets or the aerosol that is generated from a COVID-positive person. In dentistry in particular, there is a high probability of infection among healthcare providers due to the close face-to-face proximity and aerosol exposure that happens during intraoral operative or surgical procedures. Hence, the aim of this study is to analyze the knowledge and attitude of the use of mouth-nose covering amongst the dental students of our institution during the COVID-19 pandemic. After obtaining the Institutional Ethics Committee clearance, 245 willing participants were given a questionnaire via Google Documents, and these questions were segregated based on their knowledge of the various types of masks, the proper technique, the use, the maintenance, disposal, etc., and understanding their attitude towards it in the COVID-19 pandemic. When we asked about the knowledge on the topic, we have found the following results. When asked about the layers of an ideal face mask according to the WHO guidelines, about 60% of our students answered correctly that the ideal layers of the face mask is composed of the inner absorbent material, cotton, middle layer of non-woven, non-absorbent material, that is polypropylene, and an outer layer of non-absorbent material such as polyester or polyester blend. However, there was a good 40% majority who were not aware of this. Coming to the second question, according to WHO, the effective method of wearing a mask is by covering the mouth, the nose, and the chin. The chin is to be covered so as to provide a proper seal and avoid the slippage of the mask. When asked about this, we were surprised to find out that only about 75% of our students answered that only the mouth and the nose be covered, while only 25% of our students knew about this. Coming to the third question, when asked about the correct way of wearing a surgical mask, we were glad to know that about 80% of our students knew that the white side is to be facing inwards for the proper wearing, as the colored surface is the non-absorbent layer that prevents the aerosol particles from absorbing towards the inner layers. Coming to the fourth question, we asked which mouth-nose covering offers the best protection, and we were surprised to find that most of our students answered that an N95 mask is the best that provides protection to a dentist performing aerosol procedures, although it actually is the N95 respirator, as it provides a tighter fit and a better seal. Only 15% of our students answered this correctly. Now, coming to the fifth question regarding exhalation valves and vents in masks, the CDC does not recommend the usage of these masks because these masks have one-way valves or vents that allow the air to be exhaled unfiltered, that can result in expelled respiratory droplets that can reach others. And when we asked our students about this, about 66% of our students answered correctly that they should not be recommended in a healthcare setting. Coming to the sixth question, since there is an increased use of N95 masks in the past 2 years, we asked our students regarding the certification categories under NIOSH, which are the N, R, and P depending upon their resistance to oil as resistant, strongly resistant, and partially resistant categories. When questioned about this, we realized that most of our students were not aware of this classification, as 68.9% answered virus and only 8.2% answered correctly that it is oil. Coming to the seventh question, when asked about the best way to protect against the virus in a workplace, we were very glad to know that majority of our students, 91%, knew that the best way of protection is to have all masks, which includes oneself as well as others. Coming to the next question, apart from the NIOSH categories, we also asked our students regarding the European Safety Federation categories of masks that are available in India as well, which are the FFP1, 2, and 3. And the European equivalent to an N95 mask is the FFP2. And we were surprised to know that only about 38% of our students actually knew about this, and about 39% of our students actually answered FFP3. Coming to the next question, when asked about what a student assisting in aerosol generating procedure should ideally don, about 78.3% of our students answered that an N95 mask is enough. An N95 respirator is the one that is most ideal for an assistant because they would also be exposed to aerosol particles as well. About 99.8% students only answered this correctly. Coming to the 10th question, which is the final question, we asked our students on which is the most critical component of the PPE that offers the best protection during an aerosol generating procedure. And only about 66.4% of our students answered correctly, although we expected a total 100% answer on the mouth-nose covering. But there was a 29.9% who answered that it could also be the coverall or the gown as well. Coming to the questions that were used to assess the attitude of the students were also asked to select among the options whether they strongly agree, or are neutral, or they disagree or strongly disagree upon the following statements. The first statement is it is essential for all students to be educated regarding the importance of mouth-nose covering in a workplace and clinical setup before the start of college. Most of our students completely agreed to this answer, as strongly agreed answer was selected by about 84.8% students and 11.9% agreed. Coming to the second statement, that is essential for students to undergo training in appropriate technique of donning and doffing of various types of mouth-nose coverings in the workplace and clinical setup before the start of our college. Many students agreed to this answer as well, as 78.7% strongly agreed, 18.4% agreed to this statement. Coming to the third statement, that it is essential for everyone in the workplace to effectively use a mouth-nose covering at all times. 77.9% strongly agreed, 18.4% agreed, and a fraction was neutral to this topic as well. Coming to the fourth statement, it is necessary for the institute to provide an N95 mask or a respirator when performing intraoral procedures on patients. 79.1% strongly agreed, 15.2% agreed, and 5.3% were neutral on the statement. Coming to the fifth statement, I recommend the banning of valve masks in the workplace and clinics. Most of our students, that is 40.2% only, strongly agreed, whereas 28.3% agreed and 28.7% were neutral on the statement. Coming to the next statement of fine or disciplinary action being taken against people not effectively using a mouth-nose covering in the workplace, 48.4% strongly agreed, 37.7% agreed, and 13.1% were neutral on the statement. Coming to the eighth statement, in my college, if my batchmate is posted with me not wearing a mouth-nose covering appropriately, I would request my batchmate to don it properly. 64.8% strongly agreed, whereas 27% agreed, and 7.8% were neutral on the statement. Coming to the next statement, in college, if a faculty is sharing a room without adequate ventilation with me and is not wearing a mouth-nose covering appropriately, I will request the faculty to don it properly. Only 50.8% strongly agreed, whereas 29.9% agreed, and about 18% were neutral on this statement as well. Coming to the next statement, it is necessary to remove the mouth-nose covering to effectively communicate with the patient during the pandemic. 47.8% agreed. Strongly disagreed, whereas 20.9% disagreed and 8.2% were neutral, 7.4% agreed, and 16% strongly agreed to the statement. The final statement, it is necessary for the faculty and the students to remove masks during university viva voce examination for effective understanding and communication. About 44.3% strongly disagreed to the statement, 13.1% strongly agreed to the statement, whereas 23% disagreed, 9.4% were neutral, and 10.2% agreed to the statement. I would like to conclude by stating that our study showed that majority of the respondents had some basic knowledge of the importance of mouth-nose covering. They were also willing to voice the need to follow appropriate masking procedures. However, the need to reinforce this still seems very important. Thank you.